Welcome to another presentation from the CV Academics Foundation, home of the AMP Honors Program.
Well, we want to welcome everybody here to the our first live presentation here. My name is Don Hunjady. I'm part of the CV Academics Foundation team and also the AMP Honors Program team. And I'm here with four people to do our first broadcast, something that we're calling Sports Performance, Injury, Prevention and Rehabilitation, an Expert View, and also a mouthful there of a title here. Just a couple very quick housekeeping items. We are being recorded, just so everybody knows. And the guests, if you could keep yourself muted, we'd appreciate that. If you have any questions while we're going along here, just pop them into chat, and Karen or one of the other staff members will make sure that we get them to us. So let me introduce the people that are here with us this evening, or whenever you may be watching it, but if it's live, it's this evening. And I'm going to start with the introductions, but then I'm also going to have each one of them, as we move along here, tell us what they hope is going to be the take-home message for the hour that we're going to spend together here. So if there's one thing or one main thing that you think that you'd like the audience to get, let us know what it is. We're going to start with Eric Hill, who's with Project Echelon. He's a racing director there. Eric is the president of Project Echelon, which is a veterans nonprofit group, and he's also the director of the Project Echelon professional cycling team, talking bicycle cycling here. And their mission is to educate, equip, and empower veterans through physical activity. Eric himself has been competing as a collegiate and professional athlete for the last 14 years, has also worked with athletes of all ability levels through his nonprofit work. So Eric has extensive experience and knowledge regarding what it takes to perform at the elite level, and also the hurdles that athletes must overcome to stay there. So does that with the physical and mental health, injury, and rehabilitation. And great to have Project Echelon with us. Welcome, Eric.
Yeah, thank you, Don. Appreciate it.
Tell us what you're hoping that the audience is going to get out of our session today here.
Yeah, I think there's two things there. One, to walk away knowing the Project Echelon organization and what we offer and do for our veteran community, and getting into the mental health aspect of things there with educating and equipping them through physical activity. The other side of it is the performance side, and knowing how to take care of ourselves as athletes. And then as you work with athletes in the medical profession, understanding that, that we put a lot of pressure on ourselves to perform at an extremely high level. We put our bodies through a lot. And in order to stay there, we not only need to train at a high level, but we need to recover at a high level, and we need to do things that allow us to prevent ourselves from getting injury. And so having the opportunity to work with some of the docs that are on today, to work with John Huenick at BioBoto, is something that's allowed me to do that well into my 30s, which isn't something that a lot of athletes have the ability to say that they do. So, walking away with some background knowledge on what does it really mean to be an elite athlete, and what does it take to stay there.
Great. Thank you very much for being with us. Talking about John Huenick, we're going to talk with him briefly here next. He is the CEO of BioBoto USA, which is a fascinating company. I was looking at the website. John's also been a bike fitter for 25 years, and then the last 12 years, he's had a significant emphasis on the foot and proper actuation of musculoskeletal sequences in rigid shoes. I don't know what that even means, but he's doing it, and doing it for cycling, hockey, skiing, and I'm sure some other recreation, things like that. He can tell us and fill me in as well. His work has captured the eye of many physical therapists and physicians in the greater Milwaukee area, a couple of which we have here with us, and he's also now evolved into a biomechanical company that's biomechanical company that's utilizing custom sensory motor inserts and insoles as a solution for performance. And that's the fascinating part about BioBoto USA. And I'm sure he'll be able to tell us more about it as we go along here. Welcome, John, and glad to have you here. What are you hoping we get out of this session?
Yeah, thank you, Don. So I want to kind of promote out of this session that our ability to understand the athletes really aids in helping our everyday people also with their needs. So foot pain, back pain, knee pain, all of the above. We've found that our ability to look at things in the minutia for our athletes has taken them to new levels, and it allows us to see certain things that that maybe we don't always pay attention to in the office or in the practitioners. They don't have the tools that we have in their quiver to help their patients, clients, and athletes. So, so that's kind of the takeaway.
Excellent. Excellent.
You know, ideally, people understand what we do maybe just a touch better. It's somewhat simple, but at the same time complex if we get into the nuts and bolts of it.
Yeah,
so,
and we're going to come back to, and that's how we're going to start. I'm going to have you talk about a little bit of that stuff, as well as talk about Eric in how he's involved as well. Moving to the practitioner side of the house here, we've got Dr. Sylvestra Ramirez back with us. You might have seen some of her interviews on the platform or on AMP Honors program before. She's done a couple with us, and she's also doing some of our bilingual work here. Dr. Ramirez is a native of the south side here of Milwaukee, and completed her doctorate of physical therapy degree and also a master's degree in women's health. And about 7 years ago, Dr. Ramirez founded Physical Therapy of Milwaukee, which is the first bilingual, both doing English and Spanish physical therapy clinic, providing personalized rehabilitation care, and her staff also being bilingual. So the staff handles both English and Spanish. She's also an award-winning healthcare practitioner and business owner, Latina entrepreneur, and is devoted to giving back to her community and improving the healthcare and environment in the Milwaukee and surrounding communities, including the Spanish-speaking guests. And she'll be able to fill in the physical therapy side of this. Welcome back with us again, Dr. Ramirez.
Thank you, Don. Very happy to be here. I'm very happy to see fellow colleagues on this platform also, and our continued collaboration to educate the next generation. One key takeaway that I hope that I can inspire students and continue to educate is that physical therapy is a key component to at post-injury or injury prevention. So our staff and myself take a one-on-one approach to our patients in helping them heal step by step through the rehab process, acute, subacute, chronic conditions. And that is my key takeaway for today.
Awesome. And our final panelist here, the fourth person, Dr. Jim Vavra. He is a podiatrist and also with Foot and Ankle Associates of Wisconsin. Dr. Vavra is board certified podiatrist and surgeon who is also a fellow of American College of Foot and Ankle Surgery. He has been a wound care specialist for the past 7 years. An additional thing he does, that's at the Waukesha Memorial Wound Care Clinic. And then bring it kind of full circle with BioBoto USA. He's one of the founders with BioBoto USA, along with John, and is also a sports medicine expert in, of course, as you might guess, lower extremity injuries. So, Dr. Vavra, welcome. And what are you hoping we can impart here for information on this session?
Thanks, Don. I've been working with BioBoto for the last three and a half years, and I really am here to promote my sports medicine take on what we can offer these kids from this standpoint right at our lab, and what I can do for them as an injury prevention specialist at my office. We are always trying to give the best care conservatively first, and it usually starts with gait analysis and treatments that we can do on a daily basis right here at the lab. So I just want to tie everything into really what we do at our office and how I send those patients here for analysis and sensomotoric insoles. I think John has done a great job here, and I'm just here to kind of help fill in the gaps.
Excellent. We'll stay on that track to start with. John, why don't you you started a little bit and I cut you off, but why don't you tell us a little bit about BioBoto, what you guys do, the work you do, how has that evolved over time, and give us a little insight into BioBoto's the goals, the successes, the things you've done and are doing.
Yeah. So, I mean, we started early on as an orthotic lab, and this was years before we started BioBoto, but there were always challenges in the manufacturing process and the casting process from doctors, and I'm speaking in orthotic terms, right? And we just had troubles having consistent successes. And so we kind of gave the industry maybe not the best grade in the grand scheme of things. And so we were looking for different ways to come about it. My background in biomechanical evals and sports related assessments, I've been doing gait analysis since I was video analyzing it since I was 15 years old. And now we had a chance to incorporate it into our space. And so what we did was we used high-speed cameras. We have digital force plates, and we have these inserts, basically like a sock almost, that fit inside your shoes. And now we can look at gait from 100 different views, and we can identify and confirm what we see or what we don't see. And so by having this data and this information, and then laser capturing the foot, we have the most accurate way to really make anything for anybody. And we have far more information than anyone else has to make these devices. This stuff is all kind of things that all this data and technology and all of this stuff is available. It's a matter of how we put it together, but then we have to have a solution. And the standard orthosis was not the best solution for us. We found that we needed more of a response from the patient, client, athlete. And so, 12 years ago, I was putting wedges and little pieces of handlebar tape. And I think Eric actually has some of these insoles still that I whittled together for him. And we started having successes that way. And that was the beginning of it. And then we found out, I went and studied in Germany with a person in Northern Germany who is an expert in sensomotoric sensory motor insoles. And so I studied with him, Jürgen Holterhuis, and the combination of the amount of data that we gather, and now we have a ton of different options. I have 13 categories of dynamic foot types, dynamic meaning successive movements. And then inside there, each foot gets at least 16 adjustments. And so we have so much control now over what happens biomechanically that our success rate has skyrocketed. We're over 95% successful in our first dispense or visit.
And okay, now when you're talking successful, how do you measure what is a success?
Well, once we started asking these things, and I kind of challenged Jim a little bit to do it as well, find out 2 months after these people have their orthotics, their standard orthotics, how many are consistently wearing them. And then you can also measure it in how many were placing orders for second pairs, right? And then how many are coming back for adjustments, and how many solutions were never able to, or how many of the current solutions were never able to successfully treat the patient for what they came in for.
Yeah, move for a second.
Can you turn your mic on there?
Karen,
just move a little closer. That'll help.
So in my office, we probably had about 60% success with orthotics. We did a big survey about 10 years ago, and we found out that 4 out of 10 people just wear their orthotics for about a month and then they end up in the closet. And so the success rate was not where it should be and where it is now. And we even noted we caused some problems with orthotics, actually made things worse at times, putting a foot into a hard plastic device and making it do something that it's not used to doing, creating a too hard of a brace, and we were getting injuries, and it was unacceptable. And so when John and I sat down and talked about BioBoto and what he could do here, I started sending him not only my sports athletes, but I started sending him my diabetics and my patients who had wounds, and we could actually heal their wounds by offloading it properly and digitally seeing where the pressure points were. So from a simple callus to an ulcer to a person with plantar fasciitis and heel pain, I send all these people here now, and my success rate is through the roof. And it really takes the burden off me, because I can see 16 frames a second with the human eye. John can see 74 frames a second with his high-speed cameras, and and the patients appreciate it. They appreciate the fact that I'm giving them a far better service than I used to be able to offer on my own.
And non-surgically too, obviously.
Yeah.
I don't know if you're able to replacing things, but certainly, obviously, if somebody can achieve something with an orthotic that can avoid surgery, that's got to be a huge win for
Correct.
patients. Yeah, I know you guys are doing a lot with the sports in athletes and things like that. That's why I want to talk a little bit about Project Echelon and have Jim talk a little bit about his. I'm sorry, Eric, talk about his experience and stuff, and how some of the bicyclists and the racing people and stuff like that have tied into this whole circle. And then we'll open it up as we move along here to talk about rehabbing and dealing with injuries and stuff. But first, Eric, if you can talk a little bit about your team's mission and what Project Echelon does and how it kind of fits into all of this.
Sure. Yeah. So as was mentioned in the introduction, Project Echelon is kind of two parts. One, we're a veterans nonprofit that works to make physical activity more accessible to our veteran population. A large part of our veteran population, they come back from the service with partial disability, whether it's traumatic brain injury, PTSD, or actual physical injury to back, lower extremities, those types of things. It can make physical activity really demanding for them to get to, but we know that it is a really good rehabilitation tool for them and their mental health in particular. And so getting them physically active, giving them routine, giving them purpose is really important. But if it's something that's uncomfortable and creates more injury, then it's not sustainable. That's not something they're going to continue to come back to. And so on one side, we've been working with John to get our veteran athletes to see him, those who are doing running and cycling in particular, to make sure that they are properly fitted to, whether it's insoles in their shoes or to a bike, to make sure that they're not doing extra damage to their body, that they're performing at a high level, and they're doing so in a way that is going to keep them coming back to the sport. The other side of us is a professional cycling team, and we race 75 race days a year across the country, and we'll be actually going to Europe for a stint this year as well. And so to compete at that level, you're riding your bike 20 to 30 hours a week. And so if you think about riding a bike, your average cadence at an elite level is typically 90 to 100 pedal strokes a minute, which means you're pedaling roughly 6,000 times an hour. That's a lot of interaction of foot in a shoe. And the way in which your foot interacts in your shoe is going to affect the way you actuate the rest of your muscles going up. We need to get the most efficient amount of power out of our body for every pedal stroke we put in. Our races can extend as long as 6 hours. And John has been a huge help in doing that. I've been working with him since I think I was 16 years old. He's been my bike fitter for pretty much the extent of my entire career. And when he started doing this new insole work with the sensomotoric insoles and just continuously iterating the process that he's put into place, I almost immediately saw a 5 to 6% increase in my power output. And I was able to sustain that over an extended period of time, which just tells me that my muscles were firing properly and that the systems were communicating with each other in the way that they should. And then with that too, I've had a lower back injury that has just extended pretty much the course of my career. It's part from a hernia that I suffered as a collegiate runner. And I also have a leg discrepancy between my right and my left leg. And so we've been able to address those things as well, just typical anatomical discrepancies that a lot of people have that could, over the long term, have probably shortened my career. But again, I'm 32 years old and competing on the professional bike circuit for a reason. And I think that the work that's being done by this group is a large part of that.
Interesting. Very interesting. I want to bring Dr. Ramirez in here as well. And part of what we want to talk about in this session is the rehabbing, especially rehabbing someone like we just heard from Eric, and in obviously top physical condition compared to maybe rehabbing somebody like me, who's not in the top physical condition that I could be. But I got a couple questions for you. So first of all, have you worked with the Biomed USA as well, or have BioBoto rather, or is that not something you've done a lot with? And I'll let you answer that one first, and then I've got a second question for you.
Sounds good. Thank you for the question. So I've had the privilege of visiting BioBoto and seeing it firsthand. And it was, as a therapist and as somebody who loves to see how the body moves, that just gave me a whole different vision and a whole different understanding of all those pressure points in the foot. So I was just intrigued by that added information. I mean, like Dr. Vavra said, we can only see so many movements per second, and the equipment that BioBoto has to really pinpoint at such a more specific level really adds added benefit to the athlete. So I look forward to continue to our relationship and working with their patients, and myself sending them patients, because I think it's just an added benefit for any of our athletes and any of our patients that have diabetic foot sores, that are struggling with those over-the-counter orthotics. Because I, like Dr. Vavra, have seen patients that say, oh yeah, I just went to Walgreens and I stood on that machine and they told me that these are the ones I need. And I say, no, please don't stand on the machine. That's your body.
You mean
is
Dr.
very
Scholes
different.
doesn't know what he's talking about? Come on. I've trusted that guy my whole life.
And they say that to me, Eric. They say, yes. So my neighbor told me that I need to go down to Walgreens and stand on a machine, and then my foot pain or my heel pain will go away. So it's a lot of education to the community, definitely. And added resources, and the fact that we continue to collaborate at our level, at our professional level, but then also taking that to our patients and educating them culturally and linguistically that's relevant to them, and bringing that information to them and saying, well, you did purchase those, but those probably are not doing you any favors, or definitely not fixing the problem, the root cause at your ankle that's probably causing more pain at the knee. So let's take a step back and let's look at it through a different lens. And establishing that patient provider relationship is so important to us when we work one-on-one and hands-on with our patients.
Sure. And I'm going to come back to you with my second question, because I think I'm going to lead it this way. I want to talk with Dr. Vavra and find out what types of injuries do you typically see or are associated with elite and recreational activities, or even some of the bike things that we're talking about. What are you often seeing?
Well, when it comes to my athletes, the number one thing we see obviously is plantar fasciitis. And then we also see it with a lot of bike guys.
Which is what? Can you explain what plantar fasciitis is for the layperson that doesn't know?
Yeah, it's inflammation of the ligament that attaches to the heel. It'll cause pain in the morning, pain after they sit and ambulate. You can sometimes work through it with just deep tissue massage and therapy. And they're doing dry needling. They're doing a lot of things now in therapy to help alleviate the pain. We look at the mechanics and see if they're severely supinated or severely pronated, which is either high arch or flat footed, and determine if a mechanical insert would help or benefit them. And that's where BioBoto comes in. But I also will do a cortisone shot if it's a simple bursitis on the bottom of the heel. That'll eliminate pain. And then there's also an entrapped nerve that we find in the ball of the foot, which is incumbent on a lot of bikers and a lot of my runners who it's almost like carpal tunnel syndrome, but it's in the foot, it's in the forefoot. And we have a unique situation here that I've had neuroma surgery, and I actually have it videotaped, and I'm going to be putting it on the platform. Dr. Petrocarlo took out my entrapped nerve last year, but before that, the only thing that alleviated my foot pain was the inserts, the sensomotoric inserts that John made to offload that nerve, because he could actually see when I walked with the pressure mapping in my shoe where all my weight was being thrown to the lesser metatarsals, and my nerve was getting inflamed. And even with multiple cortisone shots and with John's inserts, it wouldn't shrink the nerve down enough. I was comfortable when I was in my shoes with my inserts, but when I was barefoot on hardwood floors or when I was doing anything without them, it was like a toothache. And so we've actually found a really unique solution here for a lot of my patients who have had to have surgery for neuromas, and now they can do therapy, they can do, orthotics or sensomotoric insoles. And those are the two main things that I see. And then obviously we'll see basically ingrown toenails and problems like that, dermatological problems from patients who are wearing too tight of shoes, especially in the biking world. John, that's where John comes in. He fits people so well and make sure that they're not wearing too thick of socks to where their feet will go numb, and where we'll see those type of problems in the biking world. But definitely heel pain and that neuroma pain are by far our two most common things we see.
And are they more prevalent in these elite racers or elite athletes versus just a normal everyday person?
They are, because it's from repetition. It's from poor mechanics. These kids are born with either super hypermobile feet or really rigid structured foot, and it has to do with their hereditary. So if you multiply their weight, when you're putting 5 times your body weight while you're running and stressing the foot, and you're a 150-pound athlete, and then you multiply that by 5, the amount of stress load that goes on the foot when you're an athlete or an elite athlete is going to be more pronounced. If there's even the slightest biomechanical defect in your foot, it will translate to foot and knee and hip and back. And we see it right up the closed kinetic chain all the way up to the lower back. So it's really been a blessing that we can videotape and show people that, and you can slow it down and say, hey, this is why you're having your foot. Now you're compensating, and now you're having this hip issue, and we can see it in real time.
Excellent. And John, maybe you can talk about that as well. The differences that you see between what we're calling the elite athlete and just the recreational athlete, if there's something you can add. And then Dr. Ramirez, you're going to be next, because I want to see how the rehab is different in these people as well.
Well, the elite athlete and the recreational athlete are quite different. Whatever the elite athlete's doing, it's trying to increase performance, and they will suffer an immense amount, and eventually they get tired. And so what we can do is we can identify what some of the disconnects are in their overall makeup, right? Their overall biomechanical makeup. And then we can correct for that, knowing that on the front end. But if I see somebody on the bike, I need to know how they move on the ground first, because I can't make compensations or corrections unless I know how they move naturally. And so I need to understand how they move on the ground, walking, jumping, and squatting, before I really understand what their foot's doing inside the cycling shoe. So these professional athletes, if they have poor foot mechanics, they're losing, as Eric said, 5-10%, and not gaining maybe even their peak levels. We had one cyclist that had, I would say, not poor feet, but not the best feet, and he was losing a lot of energy to the inside of the shoe. And in the end, he did a 90-second time trial, and he's 60 watts above his peak performance he's ever had. And the only thing that changed was correcting the foot. And it translates from the ankle to the pedal, and in there we can lose a lot of power. And so this is a key component for our higher performing athletes. And so now I can almost pick them out of a grind. If I had 10 guys barefoot on the stage, I could say, okay, now I know what's going on with you guys at this level for sprinting or for sustainable speeds.
Right. Very high, obviously very high tech. At least it certainly sounds that way to me. Dr. Ramirez, I know it's going to be a little bit different, but I wanted you to talk about not as much the differences in the performance stuff, but in rehabbing somebody that is an athlete versus rehabbing someone that's not an athlete. They always say don't assume, but as a layperson, I'd assume, obviously, if you're in great shape, you're going to probably rehab better and come out of injuries and surgeries and things better. But can you talk about that, the importance of just keeping yourself in good shape for just life's emergencies, like things you may see?
Definitely, definitely. So yes, there's a big difference between our athletes and our non-athletes in just the trajectory of rehab. Our athletes are just much stronger, much more flexible, have a better ability to bounce back post-injury. We do see a lot of non-athletes, your layperson, your manufacturer worker, your teacher that needs to stand. So our approach is assessing active range of motion, assessing the joint, assessing the flexibility and strength of that patient, and then tailoring the goals to what they need to know. If it's, I'm sorry, what they need to do. If I'm treating a manufacturer worker with plantar fasciitis because he has to stand all day and lift overhead, then we need to make goals and make sure that his body is functioning for the tests that he needs to perform. So our plan of care varies depending on definitely patient's age, patient's past medical history, in addition to if they have a background of athlete versus not an athlete. But more than anything, it's based off of what are their goals. So we do see the wide range from our middle school, high school student that needs to just return to soccer and wants to continue playing, to our 80, 85-year-old that just simply wants to be able to remain mobile in their home
Sure.
and be able to get up and down the steps. So we take great pride in really tailoring our treatment plan and our exercises and our plan for the patient to help them meet their goals and remain compliant with their physical therapy and eventually their home program.
Right, right. And as this starts to at least forms a picture, starts to form a picture for me, and I'm hopefully for the viewers as well. Let's see if we can put some real world things into this. So I'm going to go back to Eric, and Eric, if you can talk a little bit about what you do to prepare for a race and how you train and the things you're going through, and that hopefully will have us understand then the BioBoto end of things and the rehab and the fixing end of things based on what it is you're doing to get to those levels.
Yeah, absolutely. I mean, it starts, the cycling season, for example, typically starts in February for competition. I'm sorry, my two boys.
You have a guest there. That's okay.
Yeah,
It's
all
okay.
right. So the cycling season starts in February for competition, and it'll roll through about ends of September. So it's a pretty long season. And right now I take about two months of rest. And by rest, I mean, or 1 second, I'm sorry.
Dad's on TV, kids. That's how it always
There we
goes.
go.
When you're on
Yeah.
the telephone and when you're doing something,
Right.
that's when
No,
most
you're
entertaining is.
there. We're good. It's normal part of life, right?
Yeah.
Exactly.
So anyway, we have to take a break. You have to give your body an opportunity to recover and rejuvenate itself. But then it kind of goes into this steady build of physical strength and rebuilding that endurance. A sport like cycling or marathon running, for example, I mean, that's year over year building, right? So the benefits and strength that I have today aren't from something I did last week. It's something that I've done over the last 3 years. And so I have to have that consistency, and I need to be able to continue to build on what I've done in the past. But it'll start to build to the point where, maybe I'm doing 10 to 12 hours a week here in December, 12 to 18 hours in January, and then anywhere between 15 and 25 hours a week on the bike in the spring and throughout the rest of the year. And I have to supplement that with some strengthening, specifically, core type work. And then on the bike and running, it's so straight, it's linear. You're just going straight forward and straight backward all of the time. And so you're only working a certain subset of muscles when you do that, and not working the others. And so I need to focus a lot on my lateral movements and building strength there, because otherwise my body will start to fall apart by the time we get to June, just because of fatigue and atrophy of those other muscle groups.
Mm-hmm. It takes a lot of dedication. That's obvious.
It's definitely more than a part-time job.
Yeah,
but I don't watch a whole lot of TV. There's not time for that. So
not even if you're practicing on the bike, on the stationary bike.
Well, in the winter,
then maybe, huh?
In the winter, you're right. I'll hit Netflix up in the winter.
There you go. We've been talking a lot about, the athletic stuff and mechanics and the more bicycle racing and skiing and things like that. John, I wanted to get you back in here and talk a little bit. You touched on it, that you're doing things with diabetes and with some neurological disorders and things, something that's obviously probably vastly different, at least from my view, than a bicycle racer. So talk about some of the things that BioBoto is doing with that.
Yeah, it's pretty interesting. So understanding the foot and understanding the different movement patterns that we can do and understanding how we can come up with solutions has been a real benefit. And it's been fun to work with normal people or people that just need help sometimes, because most of my life I've been working with athletes. And so now to have these people come in with problems, we can solve these problems. So what we're doing is we use our pressure mapping techniques. And so there's 70 sensors per foot, and it reads on a Bluetooth. It's actually Wi-Fi. It reads over Wi-Fi. And we get all this data from them moving. And in most cases, our diabetics who are neuropathic, they can't feel their feet. And if they have an open wound and they can't feel their feet, they just keep walking the same. So they grind this wound right into their shoe. And we see it time and time again. And so it's our job to identify where that wound is and why they're grinding that wound and not allowing it to open or close so it stays open for a long time. I just worked with a gentleman, he's been open for 4 years, and now we're finally getting to a point where he's starting to close. There's just a little pencil lead thick spot that's open. And so to be able to bridge that gap in less than 6 months, and he's had a wound for 4 years, that's been fantastic. Yeah. So, and so it's pretty interesting to watch, but really it's the same mechanics. It's just not happening as fast and as dynamic as an athlete's foot or an athlete's, movement. And so if we can identify these gross movement patterns and then start to whittle down where the problems start or manifest, then we can really manipulate the foot so that they can walk differently, not putting the pressures on their open wound and using all of the other joints or the other parts of their foot to take the body weight.
Sure. And that's getting us into prevention again, obviously, keeping the injuries from worsening or happening in the first place. Dr. Vavra, can you talk about that and maybe expand on how John's work with BioBoto is helping with injury prevention?
Well, sure. I mean, a perfect example is the diabetic shoe program that's been out there for years. And we have people who came in and they would get casted for shoes and inserts, and we would send them on their way with a manufactured insert, but we never were able to test them to see if what I created for them would actually solve the problem or potentially create a new pressure point somewhere else. And so when you offload one area, you might onload somewhere else. And we've seen this time and time again where in my office, I've had wounds that I just about get healed, and I'll make them an insert thinking I've offloaded them properly. But lo and behold, a couple weeks later, they come up with a new blister and a new sore someplace else. And we're catching those people earlier. We're preventing those because John can test the insoles here and make sure that we're under 20 newtons per square centimeter on every part of the foot. So if he offloads one area that's got an ulcer, we can make sure that we're not adding pressure and ulcer someplace else. And that goes with all my patients who have neuropathy to even patients who just have bunions and hammer toes who are having foot pain and they want to avoid surgery. I can offload them properly too, mechanically with an insert and with proper shoe fitting before, and just prevent surgery. I mean, surgery is not a panacea. It can open a lot more, of a Pandora's box in some people, and you just have to do everything you can to prevent the operation. And there is surgery for a reason, and it should be a last resort. And for most of my patients, they appreciate that. The fact that we're actually, solving their problem and eliminating their pain with appropriate, insert, with physical therapy referrals, with occasionally a cortisone shot, and they're very happy for that.
Sure, certainly. As I was thinking about in preparing to meet with all of you, in fact, I was walking up the stairs and it was kind of dawning on me how important and how crucial your feet are to pretty much everyday life, probably only maybe second to your hands, or maybe not even, I don't know. But that, I guess, is my question. I'm going to go to Dr. Ramirez first and have her talk about the importance of the feet and probably ankles and stuff as well. And then also have Dr. Vavra comment about that, because I think it's something that we just kind of take for granted, yet that's the only way we get around.
Mm-hmm. Definitely. I think we take them for granted until something hurts. Then we say, oh my gosh, I'm feeling it in the knee. Oh, wait, I'm also feeling it in the low back. Is this because of my foot? So a lot of my patients ask those questions. And I agree with Dr. Vavra. I'm seeing more and more patients saying, I don't want to do surgery. Surgery is the last resort, maybe because of this additional COVID and the additional risks and of a surgery, but they say, no, I want to try everything. I want to try cortisone injection. I want to try therapy for 6 weeks. I want to try dry needling. I want to try everything that's out there, and surgery as extreme last resort. But I want to still continue being active. I at least want to try going out for a walk. I want to try doing my normal activity. And that's where physical therapy is such a key component to that puzzle, because we're an added benefit to helping them heal the tissue, strengthening their muscles. And we have a lot of success with our patients in educating them. And that's one of the reasons I enjoyed so much going to BioBoto, because you see where those pressure points are on the foot. And I thought that was so amazing, because when I do an evaluation with the patient, I bring out my muscle book and I'm like, this is a muscle that we're going to stretch, that we're going to strengthen, and empowering that patient more than anything, because they walk away saying, oh, now I know so much more about my shoulder, my knee, my ankle. And that helps them be much more compliant with their home program, with their healing. So that helps them take ownership also of, they also need to come to the table and do their exercises twice a day, like we prescribe. And sometimes they forget, but they will do it if they are empowered with that information.
Sure. Is there, and I don't know who I'll direct this to, I guess anybody that wants to jump in, but as we're talking about surgeries and failed surgeries, I started thinking about back injuries and stuff. And a lot of us, I think, know not to lift incorrectly or lift too heavy of things because of back injuries. But are there do's for foot and ankle as well, or things that you should not be doing, you should be avoiding, that often will get you injured?
I would say
Go ahead, Doctor.
We waited, and then I'm going to go to Dr. Sylvestra, and then we'll do Dr. Vavra next.
The first thing that comes to mind, I see a majority of my patients, a good 55 to 60% wear the wrong size shoe, wear ill-fitting shoes, be work, be women, they're just the wrong size. So that creates those additional pressure points, can start creating some neuropathy, start just creating additional problems. So getting the correct size shoe for your foot, for your feet, is so important.
Makes sense.
Yeah, I totally agree. When we see patients come in our office with black toenail or something where they're jamming their toe into a shoe that's too small, and people don't realize that as they get older, their feet collapse, their arches collapse, and they grow in shoe size, and they always want to be in that size 8. All these women, they always want to, I'm in a size 8, until the day they die. I'm like, no, you're in a size 9.5 now. And so, yeah, they're not happy about, when I measure their feet standing up and get them their actual shoe size. And then you're right, the type of shoes, we've gone to these minimalist shoes now for a while, and you can fold them up into a ball, and that's about what they're worth. They're really not giving you enough support in most cases. So there's only a few people in the world that can wear those shoes all day long, because they must have a perfect arch, and that there's very few of those people out there that I see. So, but yeah, it's the shoes, it's the shoe fit, and it's just educating people on, when they come in, what to look for in a shoe: proper heel counter, a shank in the middle of the shoe, and not, if I take their shoe off and I roll it up into a ball, they're always like, hey, I spent $80, $90 for that shoe. And you just roll it into a ball and go, well, see, I can do this with your shoe. They're not really happy about that.
But at least they see that it's not giving them the proper support. It's not doing the foot any favors. So keep rolling it up in the ball.
And it makes sense what you said too, that you don't think about it until you do have a problem. Then when you all of a sudden have a problem, even if you've been doing something the wrong way for the longest time, that's when it finally keys in for you. We've probably got about 10 minutes or so left. So I want to go around the panel again and make sure there's not something that I'm missing here, that when you guys came to this, you thought, for sure, I want to get this information out. So we'll go back and start with you, Eric. Do you want to talk any more about Project Echelon, or how it fits into to the injury prevention or the injury repairs that we're talking about, but anything else that you wanted to get out and get across to our listeners here for this panel?
No, I think just the power of physical activity. We want people staying active. We want them feeling good doing it. We want them being passionate about it. It's good for their physical health. It's good for their mental health. It's good for their social well-being. And so we can never forget that. And we want to always encourage people to be a part of that, whether it's, at a recreational level or at an elite level. We want our kids, we want our adults to be doing that, because we know there's massive benefits to it. And so taking care of your body and paying attention to the little signals that it gives you is extremely important. And the doctors that you have here today have only helped more people stay active. And so I know I can thank everybody, that's on this call for what they've done for me throughout my career. And so I hope and I know that they'll be able to help more people in a similar way.
And I'm guessing certainly the level that you're competing at in the bicycle racing thing is certainly more a young man or young woman's thing. But I would imagine that bicycling, unlike maybe running, where as the people age, they kind of recommend you don't do as much running, walk more because it's so hard on your body. But I would imagine bicycling is something that people can do into their 60s, 70s.
It's there's a ride that we do out here in Wisconsin on Saturdays. It's called the Dock Ride. And there's two groups. There's an A and a B group. But the B group, I'd be willing to bet the average age is 65. And those guys, I think they did 10 100-mile rides this year. And so yeah, it's a low impact sport, that it's a lifelong sport. As long as you're taking care of yourself and doing the little things right.
Right. John, what have I forgotten about that you wanted to get out about BioBoto? It's like I said, it's such a fascinating company and it's so involved. You almost got to get a demo or see the website. In fact, we should give out your website. I'm going to have you do that so people can look at the what I believe is real cutting edge things that you guys are doing.
Yeah, certainly. So our thought process is our feet are the first point of contact to earth. And so it really is, it's our first, and every single response in our movement patterns is based off of leveraging the ground. Okay. On the bicycle, maybe it's a little different. I need to leverage the pedal and the saddles and support body weight. But on the ground, I need to be able to leverage the ground to move forward in propulsion and gait cycles and agility courses and just in getting up the stairs, all of those things. So the first point of contact is our feet. And if our feet aren't doing the job, they're not optimizing your movement patterns, then everything kind of follows suit. So if I'm a little crooked or off kilter on my feet, then my knee has to do extra work and my hip has to do extra work. And we can follow this zigzag pattern all the way up through the shoulders. And so when we look at these things, I'm watching head position, shoulder position, arm swing, asymmetric arm swing, different hip positions. All of these that's information that I'm gathering and we can replicate because we've got high-speed video, so we can go back and we can make sure that we're understanding their movement patterns. But then being able to measure forces at the ground level is just such a powerful tool. And now we can really confirm movement patterns or change movement patterns so that we maybe can eliminate some of the aches, pains, and concerns that we have now and later.
Right. And do you see a lot, I mean, obviously every individual is different, but do you see a lot of the same patterns emerging with the people you see, or is every person or every patient unique?
Well, everyone's unique, but they do have sensory motor components, and there are systems that we are following. And I do have a number of different systems that we use to identify these movement patterns. And so now that we've done this for 3.5 years, we have learned how to refine these processes and have different corrections for different specific movements. And we're able to really get down into the little bits of the corrections. So it's been great. And our technology in making the insoles, I can make a device and I can change it less than a millimeter in some places and more than a millimeter in other places. And we have that much control now, which has been, it's been a godsend, I'd say, to
Sure.
aiding in treatment of athletes and people of all types.
Right. Dr. Vavra, what did I leave out of your area? You provided a lot of great information for us this evening
Well, you know,
as well.
I do a lot of, I see everything from pediatric kids to the geriatric, and like I said, the tools that we're now using here have made my job a lot easier. I mean, it was a lot of guesswork. There was a lot of trial and error. There was a lot of grinding, a lot of like, try this, add that pad, take this pad off. No real science behind it. Just a lot of intuition.
Mm-hmm.
And we were pretty good at it. I mean, because Dr. Petricarlo and I have been doing it for, plus 25 plus years, and he's been doing it for over 40. And then we've hired all these young kids now coming in underneath us, and they have no clue about mechanics because it's an elective now in their college. They didn't have to actually make orthotics or anything like we did. So they send everything over here. They don't even want to guess like we used to. So they're smarter than I was, that's for sure. They figured it out sooner. But we've come a long way in our practice, and we still have the same thing. We treat everyone like family, and we would not do surgery on a family member anytime until we tried and exhausted all conservative options. And that's been our mantra at Foot and Ankle Associates Wisconsin since I've been there with Dr. Petricarlo, and it'll be there long after I'm gone. So, but yeah, bringing on and really working with John hand in hand with this venture has been the most rewarding thing, because I call him my miracle worker sometimes. There's patients who literally give me hugs after they've come here to, because he's changed their life in some cases where they didn't think they could walk again, and without a limp or without a drop foot or something, and he's been able to eliminate those symptoms and get them back to somewhat of their normal life.
Wow, that is amazing to hear, and obviously gratifying for you as a practitioner, I'm sure, as it is for the patient that can avoid surgery or the invasive.
It's been
plus
amazing.
the rehab time, the recovery time. We'll give Dr. Ramirez the last word in the go around here. I didn't get to pull you in as much as I was hoping, but what did I miss as you were sitting there for the last 45 minutes or so? What information? I know you've got something, because you always do, that you wanted to get out here that we missed.
So what I've enjoyed and what I hope our participants take away is that you're hearing from professionals that love what they do, love working with our patients, love giving back to the community. And it was evident from all the answers and the information that was provided. So I appreciate all the panelists and appreciate the participants being on this call. I will echo what Eric said. Physical health and mental health go hand in hand. More now, more than ever, we're seeing a lot of that trickling down to our patients, and encouraging them to continue to remain active, even if it's 5 minutes a day, 10 minutes a day, because that mental health piece is so important. I tell my patients we have one body, and we are in charge of taking care of that body. We need to take ownership of that, and it is my job to continue empowering them how and what dose of exercise is appropriate given their age, their injury, their comorbidities.
In general, are we as a society doing better in recent years with physical activity and with prevention and things like that? My gut tells me we are, but you guys are out there seeing it.
I would definitely say so. I have a lot of patients that come to me already with information saying, okay, I Googled this. I think it's biceps tendonitis. I think it's something has to do with my Achilles. So they're already coming with that information because they want to get better. And then sometimes I have to say, no, it's probably not that. Let's redirect the information. But I appreciate that they are taking that effort to say, all right, I've tried this or I've tried that, and now I need professional help. And now I had to come to you. But no, I think you are correct, Don. I think we are better off now, given the additional resources, given the additional research and information on injuries and just the additional expertise.
Sure. Dr. Vavra or John or anybody else want to weigh in on that? Or not?
I see it. Yeah. Well, I see. I was muted there a second. So,
That's okay.
so
That's
I
okay.
see it a lot, and I can measure this when they're either on the bike or if they're doing a running analysis, or if they want to get back into running, they can come and we'll shoot video and schedule and pressure map and schedule a 60-day follow-up. And we can see if they're doing the right things. I can look in their movement patterns and identify that, yes, they are better in their movements and they're more efficient, or there's some problems and we need to go, do some other things, maybe go see Sylvestra or see Dr. Vavra. But for the most part, everybody that comes here wants to get more efficient and wants to do more in everyday life and in their athletic life. So
right.
I see it consistently.
Great.
Yeah, I totally agree, John. I think even my patients,
even my patients, they come in very well educated now. They come in with, their understanding that, it's not only in my athletes, especially, I mean, they're so into nutrition now and they're figuring that out at a much younger age. They're getting rid of a lot of the excess just junk that we used to eat. I mean, there's so many people when you see people losing weight and keeping it off now because they're understanding that not just the exercise, but their diet and their nutrition, what they put in their bodies is important. And my diabetics, I'm always like, you got to get protein, 60 grams of protein every day in your diet. And it's amazing how when they start getting that much protein in their diet every day, they all of a sudden start losing and they can get off the insulin. They can go from insulin to pills or from pills to just diet control diabetes and losing 10% of their body weight long-term, has a great effect on all their joints. So, in education's power and the students that I talk to, and they're amazing. They figure it out. I mean, they understand what to eat and what not to eat. They're not going to McDonald's every day.
Yeah, and anecdotally, I think a lot of us are seeing that. I don't know if research bears it out or not, but seeing people are more into nutrition and more into healthy eating and more into exercise and things like that. We still have a lot that would like to be and can't quite get there, but it seems like it has moved along. Before I let all of you go here, I'm going to check with Karen and the staff to see if anybody had any questions that they put in that they wanted to get out to the panel. Did we have any sitting? I'm guessing that's a no then.
Oh, hold on. We do have a question in the chat. So I don't know, but the question in the chat is, what percentage of your patient body at BioBoto are essentially healthy athletes looking for analysis for possible improvements versus people coming to you with a nagging injury that they want to diagnose and fix?
We started more in the sports related business and sports assessment, and now it's about half and half, patient to athlete. And so it's been an interesting, not that we're doing less athlete, we're just seeing more patients and percentage wise. And so a lot of it is, some of it is rehab, some of it is goals that they're setting for themselves. They want to run a half marathon or do a full marathon, or they want to race a triathlon, something of the sort. And they're having some related problems to running or cycling. And so we see that in a number of ways. Hockey players I see, and they are all performance oriented unless they have some significant issues and it's stopping them from skating. And so we see a lot of athletes coming to us. It was at first to solve problems. aches, pains, problematic situations, but now we're seeing a number of people trying to increase or enhance their performance. So it's a pretty wide spectrum now, which is actually quite fun. It makes a pretty diverse day.
Anyone else have anything on that? Or does that kind of cover it? Sounds good. Well, I want to thank all four of you, Eric, John, Dr. Ramirez, and Dr. Jim. Thank you very much for taking time out of your day or your early evening here to help us here at the AMP Honors Program. And thank you to all of those that participated live. You're part of a little bit of history since you're part of our first live event here from AMP Honors. And also it will be recorded, and hopefully we can do some things like this again. Thank you very much, guys and gals. It was very educational and very interesting to listen to.
Thank you.
Don.
Thanks, everybody.
Thank you for having us.
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.